closer. They will have like another one here. You can put another oil bottle, or you have other pockets that you can put other tools that you use. That makes it really heavy. So the thing with this is it's going to cause your lower back strain as well. Because if it gets too heavy and then you're standing holding, you will have a problem sometimes because this is very, very heavy. You might start compensating a little bit. So this is also when you have a patient who is electrician or police officer. Always lower back issue from carrying all these guns and like the tools. Okay, so I have the patient who's really young, and he's very active. He's an electrician though. He started at 18 years old. So. But he had this degeneration at a very young age. The reason is because he's kneeling down all the time with all those tools around the waist. Okay, so that is something. If the patient tells you the occupation is like police officer, any kind of officer, any like security guy, electrician that carry heavy stuff here, definitely lower back pain, 100%. Okay. From long-term wear and tear. Okay, so that's why I don't like to carry heavy stuff either. Okay, so some of your technique you can work without the oil from the petrissage. Okay, a lot of your petrissage you do need oil. For example, the kneading is, but you can still do like kneading. Okay, so circular movement. This is like increasing, peak pressure, and then releasing. Okay, did you guys learn this muscle? What muscle am I working on?
Rhomboid major.
Rhomboid? Rachel is having a heart attack.
Trapezius.
Inferior. Super is right under the trapezia. Rachel, sorry for you. Where's rhomboid?
A little bit medially.
Medially, right? So the spine, your SP, and then the medial border, and a little bit into the superior. Okay, so this area is your rhomboid. We work on this muscle quite a bit because it always gets stretched out when a patient likes to do this. Okay. Oh, poor Rachel. Rhomboids here. Okay, that's a little bit too far off. Okay. So you can do kneading like this. Okay, you can do it with your thumb, but I don't see why you would do it with the thumb. So you can do it like increasing, and then feel a little bit of knot here, increasing, and then you're coming back, and then you release. Okay, so the peak of this pressure is when you're getting to here, the middle of it, and then you're releasing, getting less and less. So I don't like to use kneading because it's a circular movement. It requires you to move more, okay? And compression we can do. So we can do compression with your knuckle. So you can do compression. Compression is pure compression, direct force, okay? So you do a compression like this, okay? So notice that I'm wrapping around my wrist because when you're transferring the force from your body down here, it's going to cause compression on your wrist. If your wrist is like this, good luck with your career. You're going to have a lot of wrist issue, okay? So keep everything kind of neutral, and some people do it like this, okay? My shoulder doesn't feel comfortable. So that's why the height of your table is important, okay? So you compress, this one you don't move. You increase the pressure, okay? And then also you can compress with your thumb. So you compress. Okay, find somewhere that's less painful or probably more painful. I feel a lot of tension here. His rotator cuff is not good, okay? So probably not comfortable either.
It's good.
So use this, and then you are going to press from here. See how I'm enforcing this instead of this. If you see people do this, and people do a lot of this, good luck. Okay, not gonna last for long unless you have like a huge thumb. Okay, and then other compression that I like to do a lot of forearm and elbow. So these techniques you can all apply without uncovering the patient. some of it actually works better if you, let's say that we want to use the forearm, okay? So you will want a broad contact. Then you find a good position first. And then notice that my back is not like this, okay? Because you are going to notice that your classmate going to bend their lower back, okay? Those ones, they are going to have problem with their lower back really soon. So your back is kind of neutral. The flexion and this kind of lowering your body coming from your knee and your hip. Basically, I'm flexing my hip. That's why this can keep straight. Otherwise, you'll be like this to get to the height, okay? The other thing is your body and this arm should not be too far away. Like this, it's not easy to apply pressure because we want to apply pressure this way, okay? So then you are going to get about like 45 degrees, not over that, okay? Not too close either. So some people do it like this, okay? So that is not good either. Okay, so you have control, you find where you want to work on, and then you find a good position. Don't rush to apply the pressure yet. And then you're going to slowly sink in. Okay, so when I'm sinking in, I'm bending my knee and my hip. So you're going to slowly sink in. Okay, so this is a broader contact, but if you want to be more specific, of course, you can go deeper with that as well. You can use your electron, so your elbow, okay? So notice my other hand is always on his body. I'm not like doing this, okay? Sometimes you feel doing this. And also this. I don't know what is this for. I see students doing this. Like, keep it neutral. Everything needs to be neutral, okay? So it looks like you're going to beat him up, okay, for some reason. Okay, keep this neutral, and some people do this. Some people do this. Okay, we don't want this. So, like you see the folds here, then I know your wrist is extended. When you do it effleurage, if I see a lot of this, I know that's not good. Okay, I see the fold here. See this tendon popping up. You're not doing relaxing kind of job for yourself. Okay, so same. I don't want to see this. Okay, sometimes I see this. Sometimes I see this. Different, I don't know why, but keep it kind of neutral. Keep this neutral, okay? And then if I want to use my elbow, first we're going to locate where we want to go, okay? So this is the medial border of his scapular, so I don't want to hit the bone. Never do bone on bone, okay? If there's something very bony, you're going to use your thumb pad or maybe the medial part of your forearm, okay? Never do bone on bone, okay? So that's why probably your massage is very painful that you received from other people. You said it was painful, right? So you find the spots because there are a lot of like trigger points along this, and then you feel this is my medial border. So I'm going to get off the medial border and then work on the muscle itself. So you're going to sink in slowly. Okay? That doesn't sound okay. Relief a little bit. Okay? So you're going to sink in slowly. Notice it's my knee and my hip going down. I'm not doing this. Okay? Then my back is already hurting. I'm bending like that. Okay? So that is compression, elbow, forearm. This, okay? Never bone on bone. Okay, face down. Is there no hole for this one?
It's full, but
Keep your face in the hole because I need your neck to be straight. Okay, another technique that we use for without the oil is the squeezing. Okay, put your arm up on the table on the side. So squeezing for the upper fiber trapezius. That one is feels pretty good usually. So squeezing, simple. Squeeze the muscle in your hands. So they said do two hands. I usually don't. So I usually will do two hands. So I reinforce it with my hand. So basically, I'm grabbing. So if you look, I'm grabbing the muscle. Okay. So nothing like this. If I see your tendon popping up like this, not good. No extension. You're gonna relax. Grab it between your thumb, palm, and and the fingers. Okay, so that's what we are doing. So grab the muscle, use the other hand for reinforce as well, and then you're going to slowly squeezing them together. Okay, I don't want to see things like this, your thumb sticking out. Just relax and then squeeze the muscle, slowly squeezing the muscle. Okay, and then hold it. Usually, even though the textbook says you do it 1 to 3 seconds per cycle, so you hold for 3 seconds and then you release. But I feel it much better when you hold for a little bit longer, maybe like even 10 seconds or so, and then you slowly releasing. Okay, so those are the techniques. You can also do it on those muscles. You can also squeeze it. So usually you can do this. Okay, squeezing the muscles. Okay, but they're much better techniques. So usually I use it on the upper fiber trapezia, and the other muscle I use is the lats. Oh, his lats is not as prominent as yours. Where's the lats? Did you guys learn that?
Yeah.
Yeah, where? Which one?
From the class.
Okay.
So
I don't care about there because I don't grab the fiber from there. It's hard. It's thinner and it's very close to the back. And it's thinner. It's on the top layer of your back muscles. Okay? So there are many layers. So usually it's more effective when you work on this area. It's thick. Where's the stool? Okay, never mind. I'm gonna go to the other side. So usually I'll be sitting here and then squeeze this muscle. If that doesn't work, good luck. It's probably gonna be painful. Okay, so you're gonna grab this muscle. You're gonna use the other hand to help to squeeze it. Oh, cannot pick him up because he's a little bit smaller glass. Okay, so you squeeze it. Ticklish. So usually this is a very effective treatment for someone who's in rotation from the tight lats. Like the other way we usually do it is also squeeze this muscle. So you squeeze them together and then you ask the patient to do an internal external rotation. So now point your fingers to Xiaojiang. Do you know who that is? I'm here. So basically, you're going to ask the patient to point. Usually mine is facing the door. All the way up as far as you can. Okay, and then point to the ground. Point to the floor again. Slowly, slowly, control your movement. Okay, so then point to the front again. To the window as far as you can go. Higher. Okay, he's definitely a little bit limited, so normally you should be able to go at least to this second degree. Okay? So you can squeeze it and ask the patient to do it about 10 times. Okay, squeeze the muscle. We also call this tendon stretch. Okay. The ringing. Okay, someone do a back breathing.有人一说话，然后就除了他这里有人在讲话，一讲话就开始有。
press.
How come I hear iliac press? We're doing back draping. How come iliac press? Yeah.
塞进去。是不是要塞这儿？对，转头这儿。
因为他 tuck in 没 tuck 到，怪他。他 tuck in 没有把侧面那个 tuck in 过来，所以这个 line 变成这里就没那么顺。对，你 tuck in 的时候，从这两边直接把它扣在里面就可以了。现在好像也没到。OK，只要你下去的时候，还有没有？有一点点。
腰窝那个。
OK。Well, don't comment on your client's body, okay? When it's not professional kind of comment, like, oh, sexy, I don't want to hear those, okay? Professional. Okay, you can talk about muscle tone, talk about the posture, talk about like symmetrical, whether the muscle is symmetrical and things like that, okay? Don't say anything that is not professional, okay? Especially for the male clients. Okay, I saw a lot of cases say that, oh, your skin is so smooth. So then you're probably going to get into trouble. Okay, remember, we are going to do a broad, and then also we are going to do broad and also superficial first. Okay, so we are going to do our effleurage. He's got a long torso, so we're probably going to need a little bit more oil. So for me, I usually come from here. That's why it's a challenge for me because I need to come from the top. I like to do this. So then my arm need to reach out a little bit, but that's okay because we are not using pressure at all right now because it's a superficial fluid technique. Okay, so you turn your hand so that you don't touch unnecessary area. Okay, so ringing, you can do it on the torso as well. So, but I said don't do it here, especially you have a female client, you don't ring here. Okay, so how do we do a ringing? So you can do it on the lower back. So you can do this, ring, and then see this torquing happening. That's the pressure. Okay, so you're doing this. So notice you're moving your body. You're not. Okay, so you're going to rotate your hip and then go down, and then you come up. I got a lot of nails. It's not my massage day. Usually my nails are freshly cut. Okay, so we can also do it on here as well. But ringing is a technique that's more for a cylinder area. So for these ones, usually we do it supine though. Okay, so but you can still do it. So you can also do a ringing from here, but you don't have your full ringing. Okay, so you can do a ringing from here. She's probably feeling my nail. And also you can do it here as well. If you're gonna do it on the thigh, don't go here. Upper inner thigh, sensitive area. No consent, no touch. Okay, so you can ring. Okay, so just like this one here, you can ring as well. It's getting a bit red. So same thing, you're gonna ring. Okay, so another technique that we do is a C-scoop. So that one is like this. Also, usually easier on where there's a muscle that allows you to pick up and kind of cylinder kind of shape. Okay, so you can make a C first. Okay, getting ready, and then you're gonna get. So you're closing this and pick it up at the same time, scooping like this. So your movement is like this. Okay, so if you make it more flow, you're gonna do this. Okay, you scoop. So this is more relaxing kind of treatment or technique because if you want to squeeze hard, it's hard on your hands. So usually we just use it as a more relaxing technique. So you do this, see, scoop up, and then the other hand comes in and scoop it up. Okay, we can do it on here as well. Anywhere you can see scoop, but not as easy because you don't really pick up too much. But you can still do the movement. You're basically going in like this and then pick up. But nothing is going to come up with you. Okay, so I do this a lot. On here, do this. Okay, those are scooping. See, scoop. Okay, any cylinder kind of shape is easier to do a C scoop.
So are you gonna put some pressure and secret or
Try not to, because it's all your hands.
still superficial?
Because the pressure coming from this, you squeezing this when you're closing your C.
Okay.
So we don't want to do it. Because pressure massage doesn't mean that you have to go really deep. You have other like compression, stripping that you can go deep. So don't pick this one, okay? Okay, so sometimes you do kneading on the patient as well if it's neck. Okay, so the neck, you have a little bit less space that you might use your thumb, right? So usually this, I don't have space for this sometimes. Okay, I can. But most of the time I will use the other thumb. Okay, so you're going to reinforce this and get to where you want to. Or you're going to come from the side and then you're going to reinforce as well. So use your body weight. Instead of this, you're going to use your body weight. So you're going to use your body weight to press it down. Okay, if I can fit my thumb, I would. Use your body weight going forward to help with the kneading. So the other kneading you can do with oil on is like doing this. Okay, and stripping as well. Stripping is you're going along the fiber direction. Kneading, you're doing circular movement. That's the difference. Effleurage, everywhere. Whatever you need to spread your oil. Is that my hair or your hair?
Why?
Okay, probably yours is shorter. Okay, stripping, I do a lot of stripping. So elbow, forearm, that's my favorite. So of course, you can do this as well. So you can do it along. So notice even my thumb is out. I don't do this. Just let it rest. Okay, and then you are going to protect your wrist. At the same time, your force is going to come from your body. Okay, so I'm leaning my body. So then you're going to strip along. Okay. So this one has pressure. So usually I only go to certain degree and I feel that I need to move, then I can continue to move. But sometimes you just transit to another technique. So sometimes you will transit to maybe a stripping kind of technique with your elbows. So what you're going to do when you get into this position first is get a good posture. Next, going to lean, apply the pressure. Last movement is the moving. Okay? So the moving is not coming from my arm doing this. It's coming from my body moving together. Okay? So you move together. And usually you go all the way to the end, and then you'll get close to the bone, and then you're probably going to turn and come back. Remember, you always come back without pressure. Okay? You don't just, to the end. Okay, let me come back here. We don't do that, okay? So you do this all the way down, and then you fly back without pressure. Don't do anything like I see people doing this, okay? So the patient doesn't know where you're going to go next. Okay, so always gliding, like your hand always on the patient's body. Finger kneading, fingertip kneading, I already did that. So stripping, usually supine, then I will strip some of the muscles on there. But like smaller muscle like your teres, minor, you guys know what that is? What are your rotator cuffs? You said yeah, so
From medium, upper medial border, lateral border.
oh, what are the rotator cuffs muscle?
Rotated.
Teres major, teres minor,
Rotated cuff. Okay.
infraspinatus, supraspinatus, subspinatus.
How come you got more than 4? You have an extra. You have an extra. Which one is not? Which one is not? Only 4.
Subscapular, infraspinatus, supraspinatus, teres minor.
Is that teres minor or major?
Minor.
Okay. Okay, there you go. So the minor, okay, not the major. Okay, so what you can do is sometimes you can do some stripping. So where does the minor go?
Good to the coffee.
minor does.
Question.
Okay, so where does it start?
Minor. The upper one third.
One third of the lateral border of the scapula.
Lateral border.
Lateral border, scapular, and then the
One
upper
third.
part of it. Okay, so basically this muscle goes this way. So it's a smaller one. So your major coming from all this and then goes this way, but your minor is up and then smaller. It goes this way as well. So you can do some stripping on it as well. So you can use your thumb and then you can strip on that as well. You okay? So usually the thumb is not very aggressive. It's not very deep. Okay, so whenever you use your thumb, you're going to reinforce. Don't do anything like this. Okay, I see people do this. Like, no, because you're using the thumb. Now I'm not using the thumb. I'm stabilizing it, and then I go with my body. Okay, so you can go like that. So that is thumb stripping, forearm stripping, elbow stripping. So definitely bigger area for bigger muscles. Of course, I do smaller muscle with my forearm as well. So usually I'll be sitting here since we don't have a chair. So usually this is very low. What is this muscle?
Triceps.
Yeah, there's only one muscle at the back of your upper arm. Okay, so this tricep you can start from, where does it go? Elbow. You're still saying elbow. Give me the. Thank you. Usually the moving one. The one you can elevate and then. Oh, now I'm too low. What is that? Olecranon process. Okay, and then it has 3 heads. That's why it's called tricep. Okay, so then you're gonna strip. Okay. So I don't know where you would like to put your hand. If I'm standing, I'll probably put it here. If I'm here, I'll probably put it here. So he knows that my hand is somewhere here. Okay. So then you are going to usually, this one will move usually. The one that rolls around. Okay. So same, we don't do this. Never try to get movement from here. Okay. Shoulder is for movement, not for the heavy stuff. Because now you're applying pressure. There's stress on the shoulder joint. Okay, so what you're gonna do, and you're gonna lean forward by moving this chair up, moving your body closer to the cushion. Okay, so I'm not wearing the right clothes for the massage as well. So you're gonna move like this. Okay, then you roll this chair forward as close as you can, and then you get to here, and then you maestro a little bit on the rotator cuff without pressure. And you come back here, and then you're gonna go again. Okay, so never go here and then okay, start again. Okay, start again. We don't want to see this. I want to see it full. So if I go here, I'm gonna come back, and then I go here again. I'm gonna come back again. Okay, so nothing breaking the contact. It is another technique because I don't usually use it. Not a lot of people using it either. So another technique, you guys remember? What is another Petrosar technique we haven't demonstrated or touched yet? What? Squeezing, we did the squeezing. Ringing, we did. Pick up. Yes. So pick up is picking up your muscle. Okay. So usually for the smaller one. That's why I don't use it. It's hard on your fingers. If you're doing a finger and you're picking up, so usually no oil is better. So you can pick up like this, light, then you don't need reinforcement. Okay, but sometimes it can be thicker muscles. So with oil, it's a little bit harder to pick up. So you're basically going to go with your palm when it's bigger, and then you squeeze it, and then you lift. Okay, so you're going to create this squeeze, and then you lift. The difference is squeezing, you just squeeze, no lifting. Okay, so this is picking up. This is squeeze. This is squeeze and then pick up. Okay, because you need a squeeze to get a hold onto the muscle, and then you lift. Hold and lift like this. Okay, so the body should feel the lifting of the muscle. Okay, so you can do it basically anywhere, but with the oil it's difficult. You can also do it here as well. Try to pick it up. More skin now because the erector is usually really tight. You won't be able to pick it
So
up.
for picking up, always covered by a sheet.
No, you can do it direct, but I already have oil.
You have to,
on, so
clean
I
oil.
won't be able to.
Without
pick it up.
oil, it's easy.
Yeah, but smaller muscles, you're probably going to be picking up easier with the fingers. Okay, but with the oil, it's difficult because it's gliding. So if any situation that you need to do a pickup, you can already apply the oil. Then you can use a sheet and then you pick up. Okay.
How about if the patient muscle is tough?
Don't use this technique though. If it's tough, you cannot pick it up. Like here, I cannot pick it up because this is the skin and the fascia. I'm not picking up his muscle at all. This is only skin. So don't use this technique if you are not able to. Like this muscle, you'll be able to pick up because it's more outside. And don't pick up here. It's gonna feel so weird. This one you might be able to pick up because it's like a bunch of muscle away from the bone, so then you can squeeze and pick up. It is difficult actually because his calf is pretty tight. So squeeze and then pick it up. Okay. So the theory is like that, but don't use it very often. But you at least you need to know. OSCE, usually you don't pick this technique, you won't have it in your OSCE. So more important is your stripping, your compression, knuckle kneading, knuckle stripping, thumb, finger, okay, finger kneading as well, finger stripping. When he's supine, you're probably gonna do more of a finger kind of stripping on the SCM here, this muscle here. Okay, so those one stripping is one direction along the fiber most of the time. Okay, unless it's a longer muscle. Okay, so stripping, the main difference is a stripping with the muscle direction, and then this you need to do circular. Any kind of kneading is a circular. That's the main difference. You need to show the examiner. I know the difference when you said kneading, knuckle kneading. I do this. When you said this stripping, a knuckle stripping, I do this. Okay, so this is a group of muscle. We call it erector spinae. Okay, so if it says, so if they said that do a knuckle stripping on the erector spinae, you're gonna do this. Okay, you're gonna strip it all the way up. Of course, you warm up first. Oh, the technique station, no warm up. Just do it. Okay, so you're gonna move together. When it gets closer to here, move. Okay, don't do this. Okay, when it says knuckle kneading on the erector spinae, so you're gonna do this. Kneading, knead your way up. Okay, so increase pressure, release pressure. So here I'm hitting a little bit of bone, probably not comfortable. So you need to be careful with the your pressure. Okay, knead all the way up. Okay, so that's the main difference. Okay, effleurage, you do all directions. You do whatever you need, as long as, because its main purpose is to transit and also spread the oil. Okay, whatever you need the oil, just move your head. But the difference is the pressure. Effleurage is very superficial. Okay, so same thing. You guys going to get ready. I'm going to call out the body structure or the muscle, since I know that you have already studied the muscle, and then you're going to perform the technique on that specific muscle or the group of muscle or the area of the body. Okay. Thank you.
Okay.
Okay, guys, get on the table.